We will call the Committee on Health and Human Services to order. Madam Clerk, roll call, please.
Each member is acknowledging that they are attending the meeting via Zoom and that they are located in Wayne County, Michigan, unless otherwise stated when I call your name. Commissioner Marecki has requested an excuse. Commissioner Dobb has requested an excuse. Commissioner Anderson?
Yes.
Commissioner Killeen?
Right here.
Chair Baker McCormick?
Here.
You have a quorum present.
Next item.
B, Chairwoman's remarks.
Well, other than just saying, I hope this rain will cease for us, at least if for tomorrow, because we do have the concert outdoors at Belle Isle, on Belle Isle, and you all are invited, and I hope this rain will stop. Next item.
C, approval of the June 22nd, 2021 meeting minutes.
I'll move approval, Madam Chair.
Support, Andrew.
It's been moved and supported. All those in favor?
Aye.
Anderson, are you in favor?
Yes.
All right. If there is anyone opposed? All right, next item, please.
D, unfinished business. There is none listed.
All right, next item.
Item 1, under new business, an update from Alita Jordan regarding COVID-19.
Good afternoon, Director Jordan. How are you?
Good afternoon, and thank you very much for having me. It's a pleasure to be here amongst this esteemed group and appreciate the opportunity to provide the report. And again, I recognize that I am certainly filling some very large shoes of Dr. Hamani, but this will be my first time to present to the group this way, and I certainly do appreciate this opportunity to provide the weekly out of Wayne County COVID-19 report. So with we can put the slides up.
1 second while I grab the slides.
Thank you. So as I can. Thank you. So the reporting period for the out of Wayne County COVID data and vaccination report today is July 4th through July 10th, 2021. Next slide. Thank you. So this slide here again shows that to date, as you can see, we have had 102,422 cumulative cases of COVID, along with 2,523 cumulative deaths since March 2020 here in Wayne County. Also, you will see from the slide below, or the information below, the positivity rate. We do not have the current rate at this time. They're providing it to us now from the state twice a week. So it will come later this afternoon and also on Thursday. So we'll be giving it a week late in terms of the information. But as you can see here, the positivity rate was slightly with a uptick of about 2% on 6/27 to 7/3. With a pretty much a 25% prevalence rate. And therefore, as we are looking at this, like I said, it's a slight uptick. However, we are still showing relatively a decline in our rates as it relates to our positivity. So again, we will keep an eye on this, but again, just a slight uptick over the past week with our percent of positivity. So the next one, we will provide you with that information. And as you can see, the lowest it has been the week of 6/20 to 6/26 was 11 or 1.2%. So again, we are monitoring this, but again, in terms of moving forward, there is a slight, like I said, a slight increase in the positivity rate. Next slide. Again, here you can see that in the out of Wayne County, again, ours show that 3.0. However, the state of Michigan, 1.6, in Detroit, 1.9%. We believe this is also related to the previous data. I guess we call it a data dump that we had between 6:30 and 7/1. As you know, cases do come through, and that at some point in time, the state actually put all of the data that they have that was either previous into the system, therefore oftentimes projecting a larger positivity rate than what they really was. And so again, we do believe this is related to the data dump that occurred the week of 6:30 through 7/1. Next slide. Again, this slide continues to show where we are as we are decreasing. As you can see, back in April and May, we had tremendous spikes. However, it has continued to decline over time. Next slide. The next slide also, if we can move to the next slide, also really shows that 14-day look back and a linear trend for confirmed cases decreasing during this reporting period. If we can move to the next slide, you'll be able to see that information, the graph that will show. Thank you. Again, this graph, as you can see, that slight uptick that I just mentioned a few slides ago, but you could also see that there is a decrease and we're continuing to move further downward in the direction that we're trying to go in. You also will see that, again, sort of a flat line in terms of not actually having any major uptick in terms of new cases. So again, I think we're moving in the right direction in terms of reducing the number of COVID cases. But again, just want to point that out in this particular slide of the confirmed cases that are being decreased over the last 30 days. All right. So again, looking at the reporting period again from July 4th to 10th, again, you can see there's been a 42% decrease in our confirmed cases from the previous week of 6/27 through 7/3. However, there was 4 new deaths and 154 new cases, which again, that slide there showed the slight uptick that we had. And the average daily count, 29 to 30 cases per day, is what we're actually demonstrating at this point. This also shows, again, in terms of looking at race and ethnicity, 58% of the new cases were Caucasian, 17% were African Americans, 3% Asian, and 17% other. And again, when you look at ethnicity, 18% among our population and 3% amongst our Hispanic and Latino. I think, again, what's significant here is 3 out of the 4 deaths were African Americans. And by gender, 60% are female, 40% have been male. Next slide, which just shows, again, graphically, just what I just pointed out. And again, we're keeping an eye on that, but recognizing, again, looking at the mean with 17% breakdown in terms of African Americans as it related to confirmed cases. So we know that we still have lots of work to do in terms of all of our ethnic groups. in terms of trying to increase vaccination uptake in this population. Next slide. Again, this slide is demonstrating again our top 5 municipalities. Dearborn at 23 or 15%, and Hamtramck, Canton Township, and Livonia. Dearborn Heights and Taylor, Westland. And as you know from the past few weeks, again, these particular municipalities have continued to be amongst the 5 top municipalities over the past 2 weeks with confirmed cases, again, total of 154, as opposed to July 27th, July 3rd, we had a total confirmed cases of 266. So again, showing some levels of decrease, but still concerning in these particular municipalities, and recognizing that we are now out in these municipalities. Actually, we've been there all along, but actually even more aggressively now, trying to make sure that we are in specific neighborhoods addressing the issue of those that are still unvaccinated and trying to increase the vaccination uptake in these particular municipalities as well. And this slide again shows in terms of the diagnostic testing, recognizing that we've had the 1,611,917 tests that have been done in terms of our diagnostic tests. And again, this is the diagnostic or viral test that's identifying persons who have been exposed or have symptoms of COVID, as well as the 82,590 serology tests that have been identified with those individuals who have shown, pretty much have shown the fact that they have an immune response to the COVID vaccine or the COVID virus. So we again have again accumulating the diagnostic capacity that we currently have. Also, we are continuing to see the average testing per million population, about 1,171 daily tests per million population. Again, in Detroit, that test number is 1,202 per million population in terms of looking at the number of daily tests that are being done in terms of detecting either the antibody or detecting people who have symptoms of the virus. Next slide. Again, showing the variants, and again that the B117, beta 117, the United Kingdom variant, again 1,392 here in the out of Wayne County cases, and so that tends to be the most prevalent one that we have that's in the county, followed by again the B1 gamma at 38. So again, we are looking at the concern is really around the B117 virus. I'm sorry, the variant that we currently have that we are continuing to keep our eye on and continue to cause us concern here in the county. With our schools beginning to close, again, we have no new school-related outbreaks that have been identified to date, although we are still doing testing at our schools, as well as there's no ongoing related outbreaks that's been identified and reported to us at this time. But again, we are still working with our schools and providing vaccinations at our schools and continuing to reach out to our young people to get them vaccinated before they go back to school. So we will be launching a very aggressive campaign as well to get parents to have their kids vaccinated. We are working towards some opportunities to incentivize our young people in terms of getting them involved in some activities that we're currently planning and will be rolling out very soon to help also encourage them to be vaccinated prior to getting back to school. Again, showing our eligibility of our populations that are being vaccinated, those who have received 1 dose and or 2 doses. And so again, out of Wayne County, you see that we are actually exceeding the state and Detroit at 63.7% that have received 1 dose. And again, 58.2% that's fully vaccinated that have received full vaccination, either with the Johnson & Johnson with 1 dose and or with our Pfizer and the Moderna vaccine at 58.2%. And so we're certainly, again, achieving and getting to where we want to be, which would be 70%, but we are moving in that direction. And so we are pleased with the numbers that we are currently at, but knowing that we still have a big push to get us to 70%. But definitely, as you look at the 63.7%, we have done an amazing job in reaching out into the communities and to the population across Wayne County and getting individuals vaccinated. So again, kudos to all of our partners out there, our neighbors, and the encouragement of our providers and professional staff that have helped us to achieve this. And we will continue to make that push to increase these numbers.
Thank you, Dr. Jordan, for that report. Do we have or will we get an analysis of those that had the vaccine, but then they also had COVID or got COVID afterwards? Do we have, or will we have those statistics?
So I don't have that level of data to determine who had COVID and then who actually became reinfected with COVID. I do not have that level of data. And I will find out from our epidemiologists, do we have the ability to provide you with that information at our next meeting. And then also one correction, I am not a doctor. I am an advanced practice nurse with a degree in nursing. And I appreciate, and of course, at one point I did start my PhD, but I did not finish that. So thank you very much. But again, I do hold a master's degree in nursing as well as a bachelor's degree in nursing as well as an advanced practice nurse. Thank you.
Thank you for that clarification. Okay, so we don't have any numbers, and we may be able to get those numbers, because I really would be interested in knowing also if you had the vaccine, but then you got COVID anyway.
Sure, we can actually, like I said, we can pull that information and I'll make it a slide for you on the next time that we meet so that you can take a look at that. So we can begin to trend that as well, if that's something that you're interested in, and knowing how many people has previously received it and then actually became infected. We can get that hospitalization data. We can get that information from some of the outpatient records that we have. So that information is readily available to us through our labs as well. So yes,
Thank you.
Happen. I just wanted to point out on this slide here, as you can see, we have reached our 65 through 74-year-olds clearly have received the initial vaccination with 1 dose, exceeding our 70% threshold that we're trying to reach in both categories, and definitely our 75 plus years of age residents as well. Again, 75.7% fully vaccinated and 81.7% of our 65 to 74-year-olds at 81%. Of course, we have tremendous opportunity with our 12 to 15-year-olds. They're currently fully vaccinated at 26%, but recognizing that we did start back in early May in terms of our 12 to 15-year-olds being eligible to receive the vaccination. And so, as I mentioned a few moments ago, we really are working to make sure that we can get those numbers increased, along with the other age demographics that we're trying to, again, improve that through new opportunities in terms of launching a strategy that will address this in the communities. Commissioner Baker.
Great. I think you all are doing an excellent job. We're definitely moving in a positive direction, and that's the goal.
Absolutely. And this slide, I'm almost finished. This slide here just simply again show where we are. In addition to, we have now aligned our strategies and our work with what we're doing with pop-ups along with canvassing. So we have moved towards an aggressive outreach, community-based public health, tried and true opportunity to reach individuals within their communities at the point of service. So therefore, not only having the sites that you see there, we're also working with the faith organizations in terms of in-home individual vaccinations. Many of our faith-based organizations have the sick and shut-in list. So we're making sure we get those lists that we're able to provide vaccinations in the home to individuals, as well as reaching our homeless population as well. So we're working with the organizations to do that. And again, if we move off to the next slide, I just want to speak a little bit about in terms of recognizing that we do have higher rates in parts of our community. And so therefore, it really is important that we have now pivoted our strategy to be, like I said, a public health community-based organization with boots on the ground and using our PR firm to help us, Mr. Mario Morrow Associates, that will move this forward in terms of 15 partners that we have in the communities to make sure that we can provide vaccinations along with the canvassing that we're doing in the communities together. So that knocking on doors, leaving leaflets, debunking myths that are out there, as well as providing testimonials, doing a tremendous amount of work on radio, getting our message out from the department, in addition to encouraging and working with partners that is helping us in every community, every ethnic background, in terms of partnering with them to provide this level of information. If we could move to the next two slides here, please. And again, this basically speaks to where we are in terms of data-driven strategies. And again, we're using our data. We have developed a spreadsheet with every census tract as well as zip code, and also looking at our MICR data that tells us exactly where we have low vaccination uptake. And therefore, that is where the concentration is, with morning, afternoon, and evening hours to 8:30, Monday through Saturday, so that we can reach this population in terms of easy access to get vaccinated. Because we know when we make easy access, individuals can actually get the vaccine. And so that really is the focus to make that happen. We are in those areas such as Hamtramck, Highland Park, Westland, Ecorse, River Rouge, Inkster, covering all of these areas. My goal eventually is to bring this down to you through what we call a geospatial mapping, so that you can actually see clearly on a map where the burden of our low vaccination uptake is within some of these communities. Because I think as you see the trend falling, I think we have to also be cognizant of the fact that we still have large pockets in the county where individuals are not vaccinated. And so that is where our concentration needs to be to get us to 70% or close as we possibly can do that, so that our neighbors are safe, you are safe, and others are safe that come in contact with us. This is a new slide that I've incorporated now, recognizing that As we try to clearly pivot in some situations, we need to make sure that we are following your policies and procedures. And so here is a slide that we are adding now, or I will be adding to continue with around emergency procurements. This particular slide actually shows the ProLink healthcare contract that was originated from April 15th through September 30th. And the amounts of these contracts that need to be coming to your committee for review, as well as, needless to say, for approval. And the ProLink contract will be coming forth to this committee for your review, as well as, let me just correct myself for a second. It should have come to your committee for review and approval. And I believe will be coming to the committee for in the very near future for your review and, of course, comments and processing. The D Group International is another contract that is April 15th through September 30th that provides the clinical staffing at the Taylor vaccine site. Again, that contract total amount is also listed here. Med National is one that's an open contract that again is not being amended and or it has not been used. But the new one that you do see that will be coming forth as an emergency procurement is the Mario Mauro and Associates contract with the start date of July 2nd, 21 through August 21st of 2021 that is assisting in terms of putting those boots on the ground in terms of providing the door-to-door community outreach, education, and awareness, but more importantly is to help us drive the process of all of the awareness and education that we're doing, but also making sure that we can get the individuals to our pop-ups as well as to the sites that we currently have. And again, the expected outcome from all of this additional work and having people in the community and knocking on doors and following up is to really improve the vaccination uptake in these focused areas that I previously mentioned, which again are the Wayne, Westland, Highland, Hamtramck, River Rouge, Encore, and Harper Woods are some of the concentrated areas that we are being focused in terms of making sure that we can increase education, increase awareness, and address the concerns of the community to mitigate the barriers that they perhaps have encountered in terms of getting or not getting a vaccine. I see a number of hands up, so I'll stop there. Commissioner Baker.
All right. Commissioner Colleen.
Well, I saw our COO had her hand up, Ms. Allen, and I was just wondering if she had something to contribute before the politicians start in. I'm just saying.
Ms. Allen, did you want to comment before Commissioner Colleen?
Yes, I appreciate that. Good afternoon. To the committee through the chair, I'm Janelle Allen, Chief Operating Officer with the County Executive's Office. I did just want to add some clarification around this slide that Ms. Jordan will start including in her regular reports with regard to emergency procurements. This is just one effort on our behalf to make sure that the commissioners are aware as soon as possible about any time we think we're going to use an emergency procurement. These actually, just by the nature of itself of the emergency, as you know, that the emergencies then they actually get approved and then they come to the commission as a receipt and file. And we do know at times that's after the fact, but just because of the nature of the emergency, that is the process. What I've asked Ms. Jordan to start doing though is when we know that we're even considering a new emergency, that's included in her biweekly report to you. So you will at least have a heads up before it actually is awarded as an emergency. Another effort that we have implemented on the heels of our meeting with some commissioners and commission staff, again expressing concerns about appropriate use of emergencies, is that we're starting now to bring an amendment to an emergency will come to the commission for approval, as opposed to processing an amendment as an emergency. I do want to note that the first three contracts noted here, the ProLink, D Group and Med National, those amendments were processed the old way, where the amendments were processed as emergencies and they were coming to the commission as receipt and file. However, the Mario Mauro contract, which we actually just awarded the initial part of the contract as an emergency to deal with the immediacy that we needed his company to get out knocking on doors. And we do have some rigidity with the availability of funds, but we're also amending the contract. So the initial procurement period is July 2nd through August 21st. And we have allotted that time to have sufficient time to get through the commission approval process. We are simultaneously processing an amendment for the period of August 22nd through September 30th, but that is coming to the commission in advance for approval. And again, the ProLink, D Group, Met National should be the last ones that you will see where an amendment was processed as an emergency. We assure you amendments will be coming. Amendments to emergencies will come to you for approval before they are awarded.
Thank you for that explanation. I think that's very helpful to us in knowing what you're working on and what contracts are coming through before they actually are approved. Even though we know you have the power to do that, we appreciate you trying to work with us so that we know that these contracts are timely and we know that there's a need for them. So, all right, Commissioner Killeen.
Thank you, Madam Chair. A couple of questions here. Do we know how many people in Wayne County have taken advantage of having someone come to their home to give them a jab, as we say these days? Do we know how many people have used that? It's marvelous to offer, but I'm just curious how many people have taken advantage of that, if we know.
So Commissioner, I don't have that information readily at my fingertips, but I certainly can get that information from you, from my public health director, in terms of how many people that we have currently went to their homes. We do have a 211 number that people can call, and then we do try to respond within 24 hours of that call to get a public health nurse out to their home to provide that vaccination. And so that's also a weekly tracking mechanism that I've put in place as well, that as we start with our canvassing, to make sure that I can get a weekly update on that. So on Tuesday mornings, I will get that report, or actually by Tuesday afternoons at 3 o'clock, I will also have that report to tell me how many individuals had received from their homes a vaccine from my staff. So
Okay.
I will include that in my next report as well.
Yeah, well, just for effectiveness, and I also think in these matters, people need to be reminded again and again and again and again. And I'm trying, with all the community Facebook pages and whatnot in my district to post it often. But to that point, if you have a flyer for Wayne County Community College out there on 8 Mile in Harper Woods, when it's open, when you can go there,
Yes.
I would certainly love that. And it's even better if it's social media ready. And so I don't have to fool around with a PDF and figure out how the heck to get that up. But I'm also reminding people to call the local number for the people that will give you the shot in home. I'm assuming the community-based approach, which is marvelous, Hamtramck, Highland Park, Westland, those are the out-county communities with the lowest vaccination rates? Is that
Yes,
who we're
they
targeting?
are. Yes, and I have a chart I'm happy to share with you as well that shows the entire county where I have low rates at.
Yeah.
It is on a spreadsheet, so I could pull that up and show you that as well. But the answer to that question is yes, you have low uptake there. And also, in response to your question about Harper Woods, I can provide you with the flyers that we do have that is social media ready, along with the hours. And in addition to that, we actually have some pop-ups through there with canvassing that's going on in Harper Woods as we speak. And I'll give,
And I think if communications can just share that with every commissioner on
Absolutely.
a fairly regular basis, right? Uh,
yes,
And I don't necessarily need to see all 43 communities and right, you guys see that and see what the ranking is. What sticks in my mind is we're in a pandemic, right? Today, your community is down, tomorrow your community can be up. You know, it's just the very nature of the thing here. And I look around at some numbers. The variants right from the beginning have always concerned me with my biology background, right? It's just what viruses do.
yes.
So yeah, the UK variant hasn't been good, but boy, this Delta variant is such a threat. And I'm looking at Detroit's numbers. Basically, 2/3 of Detroit is defenseless against that.
Yes.
The numbers, you know, around Delta, if you've only had one shot, you still have a very good chance, 60 or 70% chance of it affecting you. And so you need both the doses. So I basically look at city of Detroit right next door is an incubator, 2/3 of those citizens. And those numbers are just going to go up. And they might go up fairly significantly with the aggressiveness of this thing. And of course, then we have communities out county where about 1/3 just in aggregate of out county is defenseless right now. And around the world. Has 10% of the world been vaccinated yet? I don't think so. And so there's going to be more variants to come.
You're absolutely correct. And the data absolutely show that. As you well know, most recently, a week ago, the CDC reported, as well as the news media reported, again, as you know, what happened in Baltimore, Maryland.
Yep.
Again, more than 100 people were hospitalized and died due to COVID because they were not vaccinated. And so
Right.
that was documented. And so there is a research study that's looking at vaccines can clearly show the evidence is there that if you're not vaccinated, that again, a more serious impact that you will have from the COVID and from the Delta virus.
Absolutely. And I wouldn't want to be in Missouri right now either. I mean, in a
Yes.
bunch of states. So I like the strategy and getting the word out. Funny thing, vaccines work. Who
Yes.
knew, right? And so a lot of people are getting protection, even if they don't have the vaccine, because the number of people that have received it. So really appreciate the work that you're doing and the information you're providing. That Delta worries the heck out of me. Our community is still, and individuals in our community are still very much at risk with that baby. And then hopefully there's not another one coming down the pike, but it's the nature of biology. And if 90–95% of the planet is not protected, that's a fantastic laboratory for new variants to emerge from. So thank you for the work. Thank you for the report. Thank you for the time, Madam Chair.
Thank you, Commissioner Killeen. And again, thank you, Director Jordan, for joining us today. And I guess you'll be giving us the updates from now and moving forward, right? Is that correct? All right. Well, then I look forward to seeing you in about 2 weeks.
Yes, thank you.
Thank you. Thank you so much. All right, Madam Clerk. We will proceed to the next item.
Item 2, requesting commission approval of an intergovernmental agreement with the Detroit Wayne Integrated Health Network.
All right, is there any discussion on this item?
I have a question, Madam Chair, but I'll move it for approval.
All right, thank you. Is there support?
Support, Anderson.
Thank you. Go right ahead, Commissioner Killeen.
Thank you. I didn't think that intergovernmental agreements, IGAs like this, came before the commission for approval. There was some discussion in the staff paperwork about why this is coming for our approval. Could somebody recapitulate that, please? Go over that one more time.
Good afternoon, through the chair, Ebony McCann, Administrator, Adult Community Corrections. It is my understanding that this agreement has historically been presented to commission for approval. The funding comes directly from the award that Community Corrections receives from the Michigan Department of Corrections. I will stop right there because I see that Felicia Johnson has her hand raised.
Oh no, Ebony, please continue. I'll chime in
Make
when
room
you're
for the
done.
boss.
So as I've indicated, it is my understanding that this agreement has been before the board. There has been some confusion as to whether or not most community corrections matters are presented in front of PS&J. And I believe because this involves the authority or the network, excuse me, it is on this agenda for today.
Through the chair, just a general comment with regards to IGA. So IGAs have historically come to this body. I can't speak to which committee they have been assigned to, but they have been approved by the commission. The charter says that this body approves the making of all contracts. This body has delegated some authority with regards to contracts under the procurement ordinance, but IGAs are not a part of that delegated authority, so we do get IGAs.
All righty, thank you. But we've been doing this a couple of years now with the Detroit Wayne Integrated Health Network. And this is community corrections. This is definitely the right direction to go in, is to provide people outside of incarceration with help in their communities for the issues they may be having. This is absolutely the right direction for us to go to. Treatment and keeping people home rather than incarcerating people that have these issues. And as a kicker, since it is an IGA, that the Michigan Department of Corrections through the Community Corrections Plan, through our Community Corrections Plan, the state of Michigan is basically paying for this. So this is a great thing all the way around. Thank you, Madam Chair.
Thank you, Commissioner Killeen. It has been moved and supported. All those in favor?
Aye.
Aye.
Any opposed? None opposed, motion passed. Next item, please.
F, such other matters as may be properly submitted before the committee.
There are no other such matters. Next item.
Madam Chair.
Oh, yes.
I just
Commissioner.
wanted to back up. I wonder if we need a roll call vote for that interlocal agreement.
We'll do a roll call vote.
I'm thinking because it is approving rather than just accepting like a notification.
No problem. I guess each committee does things differently. So we'll do a roll call vote.
Commission Counsel, is that required?
So through the chair, and I think I somewhat missed the vote, but so long as it was clear how every commissioner voted and that every commissioner actually voted, then no, we don't have to take a roll call at this point.
I think we didn't have every commissioner expressing a vote.
Well, we only have you and also Commissioner Killeen. So it's only two in the meeting. Marecki and Dobb were excused.
Count yourself, Madam Chair.
Yeah, and myself, right. Of course, I vote yes.
Okay, if we have a majority, I guess we're good.
Okay. So we will continue on with such other matters, which again, I don't believe there are any. And so we can go to public, next item. Public comments.
Public comments.
Can you unmute everyone? And does anyone have any comments from the public? Anyone out there? Any emails?
No emails have been received.
All right, thank you. we will move to the next item.
Adjournment.
I'll move that, Madam Chair, Colleen.
Is it support?
Support.
All right, well, we are adjourned. Thank you.
Thank you.
Madam Chair.
All right, have a good rest of your day. Bye-bye.
Mhm.
Thank you.